Thank you for being here. TCE in my water and air has been something that I've been dealing with since I found out on the 26th of May in 2003 at about 5:15 in the afternoon. And ever since then, it's been just it's been a roller coaster of promises and finding out new things as far as vapor intrusion, and it's just been very, very hard to deal with, but thankfully with the Congressman here supporting us, I couldn't ask for anything more. And this legislation today that the Congressman is going to talk about is extremely important. It's going to force the EPA to do something. It's going to force the EPA to lower the standards that need to be lowered. I knew about this in 2003 when I started doing research about it, and it's a no-brainer. It needs to be done. It needs to be lowered, and there needs to be something done throughout the entire country for vapor intrusion. Right now, anyone could do whatever they want. As far as some states have no legislation at all. Some states have some guidelines, but it seems like people have all different sites. Thank you, Duncan. All different sites have different guidelines. There's not one guideline that anybody really uses, and it's really not fair from one site to the next. And that's what this legislation is about. It's about making the EPA set protective standards. We don't have protective standards right now. And we have people in homes here in Hopewell Junction that have just a little bit of contamination, but not enough to have filters put in. But that's not good enough. So I'm going to, Supervisor Hickman is here from the town of East Fishkill. Thank you for being here. Bill McCabe from, which legislation, you're Dutchess County legislator from what district?
District 13 from Unionville, LaGrange, and Wappinger.
Okay. And of course we have Congressman Hall. I can't forget his last name, it's in his mind. And that's why we're here today. And my neighbors that are going to speak, Ann Culver, Sharon Whalen.
Okay. Do you mind if I stand while I...
Please do.
Good morning, ladies and gentlemen. My name is John Hickman, and I am the supervisor of the town of East Fishkill. I'd like to thank you for being here today. Many towns, cities, and villages throughout the country have experienced severe impacts due to groundwater contamination. The effects on health, welfare, and not to mention property are tremendous. Even our own beautiful town of East Fishkill, we have endured such experiences. We have been fortunate in our town to have Deborah Hall and Bill Burrell and the Citizens for Clean Water to make the problems in this area known. These problems have not fallen on deaf ears. Our Congressman, John Hall, understands our plight, and Congressman Hall has been working to address these issues of groundwater contamination. I am honored today to introduce Congressman John Hall to this gathering, and I'd like to thank you for letting me be here. Congressman.
Thank you, sir. Supervisor Hickman and Deborah, I want to thank you for inviting us into your home. Congratulations on your EPA award, as well as the other awards that you were showing me before. And you know, awards are nice, and to the extent that there's been help, that's better than nothing. But as you said, the standards need to be lowered, and more people need to be protected from TCE. I also want to thank David Hall. And Jeff Cover and Sharon Whalen, thank you for being here. Neighbors on Creamery Road, all of whom are impacted with water and air contamination and have health problems in their family as a result. And Bill Burrell, I believe, is also here.
He's not.
Bill didn't make it.
He had to work.
Well, somebody's got to work. I'm glad he's holding down the fort. Needless to say, there are more. But the Hopewell Precision Site has been listed on the Superfund's notorious national priority list, meaning it's one of the most polluted sites in the country. Hopewell Precision got rid of toxic TCE, trichloroethylene, and I always figured the more syllables and the harder to pronounce, the more dangerous it is. But the abbreviation, the initials, should be warning enough. TCE, simply by dumping it on the ground. And as we know now, many of us, more of us know now, when you dump something on the ground or on your driveway or into a drain, it doesn't just magically disappear. It winds up in the water, and most unfortunately in the water that we drink. As a result, there's a 1.5 mile long plume extending from this site, leaching into groundwater, rising to the surface as vapor and undermining the quality of life of everybody near the trail. TCE is a pervasive toxic chemical. It cannot be allowed to continue to pollute our communities. In studies, it's been shown as a likely carcinogen. It can cause nerve damage, can lead to developmental difficulties in children, and pose a significant threat to public health in multiple ways. In a 2001 draft risk assessment by the EPA, TCE is found to be 40 times more likely to cause cancer than it had been assumed. So what did the EPA do when they got that bad news, the report from 2001? Well, they commissioned another study. And unfortunately, government does this too often. It postpones action by commissioning more studies. Unfortunately, with this EPA, I would say they frequently disregard their own studies. And we need to take action based on science, not based on some corporate risk benefit analysis or the hope that this will go away. In fact, the 2006 National Academy of Sciences study showed that it was even more dangerous. TCE was even more dangerous than the 2001 study had shown. So it's time now to make a concrete decision and take some firm and concrete action. In the first week of the Water Resources Subcommittee last year, I asked the head of the EPA's clean water programs what EPA intended to do to move ahead on cleaning up the TCE spill here in Hopewell Junction, and asked again this year, only to get the same runaround. EPA should not just study the impact of TCE, it should take steps to protect public health and the environment. That is its charge under the law. We are tired of waiting for the EPA to learn what we already know, that TCE is a poison and that we need to take swift action to get it out of our air and our water. Not to mention our soil. This week I will be joining with Congressman Hinchey in introducing legislation to do just that. We will be introducing the TCE Reduction Act of 2008 to make EPA meet its responsibilities. Specifically, this bill will require the EPA to publish a revised health advisory for TCE within 6 months that protects women, infants, and children. To create a drinking water standard for TCE within 18 months that will protect vulnerable populations, set a maximum containment level, and to put forth the health standard for vapor intrusion within a year with an integrated risk information system rating of TCE vapor in a year and a half. We're introducing this bill in the House as a companion to the work that Senator Clinton has done in the Senate. I look forward to working with my colleagues to make sure that communities like Hopewell Junction get their needs addressed and their the health of themselves and their families and their neighbors protected. And at this point I'd like to ask Ann and Jeff Cover, if you'd like to... Ann, step right up.
Before I read my statement, I just kind of want to say this is the first time we've really spoken publicly about our son Matthew. So if I get emotional, it's because we've chosen to deal with Matthew. He's our child and we love him very much. But Matthew's story I think is important because birth defects from TCE do occur, and Matt is probably a prime example. We've lived at this address for 21 years, since 1986. We brought up 3 children in a house that we shared with my parents. Our children are 24, 22, and 17. Matt was born in 1990. He's a special needs child. At birth, he was determined to be mentally deficit, totally blind, and suffered such severe motor issues that he could not feed properly or turn over on his own. He's the only one of the children who was born on Creamery Road. Our other 2 children are healthy and well. Shortly after we moved here, my daughter Amy had some episodes where she would pass out. Like good parents, we took her to a neurologist who diagnosed a nerve that was supposed to develop, that didn't quite develop properly. And while we were talking, he said, you know, this is really funny. He said, this is kind of a rare problem. I have 2 other children on your road and in your area who have it. And he jokingly said, is it in the water? Little did he know. Life went on. Along came the issues with the water and the TCE in our well, which we drank and showered with for years. We've suffered from severe dry skin, scalp disorders, and headaches. We now have a POET system and a vapor intrusion system. We've also lost some friends in the area over the year to cancer, which it's phenomenal to know 3 people within a mile of where I live whose homes are affected by TCE who have died of cancer. Now, Matt has been seen over the years by many top doctors, above and beyond belief. My brother's a physician. He tapped every doctor he could find to help us out. The upshot is, it wasn't genetic, but they couldn't tell us what it was. When TCE came along, we started to catalog Matt's disorders. They all fall into the realm of children who are affected by a teratogen, such as TCE, while their mother is pregnant. His visual disorder is caused by an improperly developed optic nerve damage. His motor disorders are caused by nerve damage. His brain doesn't respond and receive messages, causing him to be mentally deficit. His motor disorder is so bad that he could not keep his body up and recently just had scoliosis surgery. He's also had a kidney transplant. And it took him 4 years to learn how to say I love you, only through a specialist, because he couldn't swallow, he couldn't eat, and he couldn't speak. He still has disabilities. He can't zip a zipper, he can't button a button, but he will make you laugh and smile. There's no proof. The doctors don't have proof yet. It's still too early in testing for TCE, but we do believe that TCE contributed to Matt's disorders. We would like to see greater testing because we really don't want to see another family go through what we do. It isn't fair. It isn't fair to the kids, and it isn't fair to the families. So we'd like to see this. Thank you.
Thank you very much. It isn't fair. It sounds paltry to mention when you talk about your child's health problems, but obviously it's not fair to you in terms of what it's done to your property values or anybody's property values around here either. And knowing how difficult the housing market is anyway for everybody right now, you know, this is a case in which it's obviously an extremely detrimental effect. Superfund, which is under the jurisdiction of the Water Resources and Environment Subcommittee that I sit on the Transportation and Infrastructure Committee, Superfund is the means by which Congress decided decades ago to make the polluter pay. And one of the things we want to try to do in this Congress this year is to reauthorize Superfund and to put enough money back into it so that it can remediate these sites, try to minimize the damage to the families who are affected, and then go after the companies who profited by dumping that pollution into the ground and ultimately making them pay for it. Sharon Whalen?
My name is Sharon Whalen, and I live in the area contaminated by Hopewell Precision. I remember buying my house on December 24th, 1999. I couldn't wait to move into my home. To me, a home means a place where you're comfortable and safe. Unbeknownst to me, my home was not safe at all. After living there for a while, my husband and I were always getting sick. I had so many upper respiratory and sinus infections one year that my doctor tested to see if I had an immune disease. My husband's bosses dubbed our house the sick house. They knew how healthy we used to be before moving into our home. My father, who lives downstairs, had been stricken with prostate cancer. There are no family members on his side who have had any kind of cancers. The EPA installed a vapor intrusion system in my home. This did not cure the problem until they added onto it. That's how grossly contaminated my air was with TCE. My water has not been contaminated, but I will say, not yet. I fear for others who are living with TCE, especially since no one can really tell you for sure what the effects are. I can tell you that after my air was cleaned, I have hardly had any upper respiratory or sinus infections again. I would especially like to thank Congressman John Hall, Congressman Maurice Hinchey, and Hillary Clinton for listening to our concerns and doing something about it. Thank you.
This is the end of our regular scheduled program, and Bill, do you want to say anything?
I just want to say that these kinds of issues are all over Dutchess County and all over the state of New York, and I really think that we should have statewide regulations as well regarding testing of private wells and dealing with vapor intrusion. We're trying very, very hard to do it in Dutchess County, but I think that that's not enough. It should be statewide regulations. Thanks so much for coming, for introducing this in the United States.
Congressman, may I just, before we close, I'd like to say a couple things. I'd like to echo what our county legislator has said and thank Deborah Hall. Town of East Fishkill did adopt a mandatory well testing laws, did the town of Fishkill, town of Wappinger, and not with a lot of input from Deborah and her people. We recognize the value of clean water, and we certainly don't have the resources of the EPA, but I can assure you the town of East Fishkill will do whatever we can do. We have a source of water not far from here. We've upsized the tank, and when the time comes that the EPA says we need to get water into this area, central water, we're prepared to move on that. So I just want to let everybody know we'll do what we can do. And my heart goes out to the families. This is truly
Serious issue.
touching.
I'd like to say something. These are two of many, and it's heartbreaking. When I've gone to lots of doors and I've heard lots of stories, and a lot of people don't want to come out and speak about what's going on because they don't want to embarrass their kids, or they don't want to speak in public, or they just want, they just figure it's going to get taken care of. But there's many, many stories of people who have had problems, health problems, and some of them have gotten better once the systems were put in. I don't think it's a coincidence. And something needs to be done.
Are there any questions from the media folks?
I guess my big thing is, and I'm just only playing devil's advocate, so please, forgive me. Yes. Many people are just going to ask, why not move? Why not get out of here as soon as you can? Take your families and get out and go somewhere else.
Because
do you want to buy my house?
No.
Okay,
that's
thank
for sure.
you.
Is that something that is required when they go to sell their home? They have to make sure that this is known to the next buyer?
no, you can pay $400,
$500
to keep it a secret. But would you be able to do that with a clear conscience? I couldn't. And you know what? That's my home. That is where I put all of my money before I knew what the problem was. And I've made my home a home, and I would not sell my home to someone because I would never buy a contaminated home. I mean, yes, it's safe now, But, you know, I don't have water contamination with all the building and the water tables changing. I may have that down the road. It took 1 year. I just got the results for my water testing from June of last year, the other day. That's a long time for contamination, for people to be exposed for it, but, you know, you go on a hope and a prayer.
You also need to remember that we weren't told about this contamination until many years after exposure. How long was I exposed to it before I knew? Over 15 years. So you're asking me, you can't blame us for what we didn't know 15 years ago. Had I known, would I have done something differently? Absolutely. I would never have moved up here, ever, in a heartbeat, and exposed myself for my kids. But once the county and the town and the state knew, nobody told us. That wasn't important at the time.
The thing I'm concerned about is the 1.5 mile long plume, which is getting longer as we speak. One can only assume that it's spreading. And Deborah, you probably know the answer to this question. Know what the current safe parts per million level, what they call is safe. As with all exposures to chemicals or radiation or what have you, various pathogens, EPA sets what they consider to be a safe threshold. My feeling is that there is no threshold, that it's only a matter of, less exposure means less danger, but there's no level of absolute safety, that you might just have milder effects at a lower level. But
Right.
That's my non-scientific guess.
It's like being a little bit pregnant.
Right, you can have a little bit of nerve damage or you can have a lot of nerve damage.
Right.
But as that plume spreads, we need to at least alert the people whose wells it is spreading toward and make sure that we're ahead of the curve in monitoring their water and air.
The plume is
But-
underwater or not above? Is it in the air?
It's in the aquifer.
It's in the aquifer in it, and by a process called vapor intrusion, as well as our water being contaminated, the fumes from the aquifer rise up through the soil and go into your homes. So you're breathing it as well as washing in it and drinking it and everything else that you do with water.
Anybody else? Well, once again, thank you, Deborah, for your hospitality and for your persistence. You and your neighbors, but especially you, have been at the forefront of this particular fight, and I'm sorry to say that it's one of 7 Superfund sites in my district, the 5 counties that I represent in Congress, and it is the worst one of the 7, but it's a shame for me to realize that there are 7. Some of them have been remediated and taken off the list. Most of them are still active, but we're working very hard and trying to follow through on all of them. But this one is the main one that triggered the legislation. Congressman Hinchey, by the way, right now is in Endicott, New York, out in the western part of his district, holding a press conference to announce this legislation at a Superfund TCE site in Endicott. So we're going to attempt to raise the consciousness in Congress in many districts where this kind of problem has taken place, and people are experiencing similar health effects. And I suspect we'll have support for the bill. We'll start this week lining up co-sponsors and see how quickly we can move it.
Thank you.
Thank you very much.